I think in the U.S., there's three main challenges that we're going to face in the next 10 years. So one is funding for agricultural safety and health efforts. Number two is the opioid crisis, which is striking America right now. And then number three is mental health support for farmers and rural people. So I think those are the three biggest things. Our funding stream in the United States, primarily we get funded for agricultural safety and health efforts in the United States. We get funding from the federal government through NIOSH, the National Institute for Occupational Safety and Health. So since 2010, that funding has been under threat of being cut completely out of the federal budget. So if that happens, there would not be much resources left available to do agricultural safety and health work in the United States. So there's about 23 million US dollars that are given out in grants to 11 ag safety and health centers in the United States. When I started at NICAM in New York 14 years ago, there were 9 centers, now there's 11. So we've increased the number of ag safety and health centers in the US, but the funding has not changed. It's been level funding. So that's essentially like a funding cut. And if that did go away, the only resource farmers or people working in agriculture, the only resource they'd have for safety and health efforts would be OSHA, which is the U.S. federal government's Occupational Safety and Health Administration. And they're primarily enforcement. They only have a little bit left over for education and outreach. So that would not be a very good situation if we do lose that funding. And the directors of the ag safety centers in the United States have to spend a lot of time lobbying for the funding to stay in the budget. So they go to Washington, D.C. and lobby politicians to keep that funding in the budget. So far they've been successful, so that's a good thing. And OSHA is spread very thin. There's only 2,000 compliance officers in the United States for over 8 million businesses. And just a small percentage of them actually do outreach and education. So that's not a good situation either. There are a few private organizations doing ag safety and health work in the United States, but they're small, like the AgriSafe Network is probably one of the ones people could call upon. The Progressive Ag Foundation, which does safety day camps around the United States and in North America. And then the Ag Safety and Health Alliance. Number two is the opioid crisis, so that is getting worse in the United States. Just last week, the U.S. Centers for Disease Control, they announced just last week that 76,000 Americans died of drug overdoses. And the year prior to that, it was around 42,000, so it almost doubled in that short amount of time. And it's primarily a disease of rural white Americans. It's not as prevalent in urban areas, but it is happening in the cities too. So this crisis is going to overwhelm what little resources are already there for ag safety and health efforts. The life expectancy for white U.S. males in the United States has dropped. That's dropped, and drug suicide has increased too. So the opioid crisis has a direct impact on safety and health, of course. The American Farm Bureau Federation recently did an exhaustive report on the statistics of this epidemic. So if anyone wanted a link to that report, I could find that for them, because they did a pretty good job with all the statistics that are on this. Number three is just mental health support for farmers and rural people. They're an underserved population in our country, and there's not a lot of resources to help them with mental health support or care that they might need. Farmers in the U.S. have the highest rate of occupational suicide. The U.S. farmer suicide rate is 8 times higher than the average for all U.S. citizens. It's people like myself, people working in the field of ag safety and health, we need more education on this issue. We need education on how to identify symptoms of somebody that is severely depressed and contemplating suicide. We have to be able to recognize when someone is like that, and then if we do, where do we steer them? What do we do for that person to get them the help they need? So those are the three main areas that I think are going to be the biggest challenges, at least in the United States. That's what I'm most familiar with. But funding for ag safety and health efforts, the opioid crisis, addressing that and trying to reverse that, and then mental health support for farmers and rural people.